You woke up with fever, body aches, and a positive flu test. Do you go to urgent care, schedule a televisit, or head straight to the ER? The CDC estimates more than 15 million flu cases this season so far, and activity continues to climb. So it's important to know where to seek care, how long it's safe to wait, and how to use home tests appropriately. My name is Slava Krinovich. I'm a nurse practitioner with over 20 years of experience and a daughter actively caring for an aging parent with cancer. On this channel, I translate complex medical and life systems into clear steps so adult children like we all are of aging parents can prepare before crisis hits, communicate confidently with doctors and healthcare teams, organize finances, paperwork, and daily care, and support their parents without losing themselves. So today we're discussing when urgent care is the right choice, when the ER is necessary, where televisits fit in, and how home COVID, flu, and urine tests can help guide the decisions. Who can safely wait and who should be seen right away. And a quick January reminder about preventable exercise injuries. Healthcare works best when we use the right tools for the right problem. The goal is not to avoid the ER at any cost. And it's also not to rush to the ER for everything. The goal is to choose the level of care that is safe, timely, and appropriate for the situation. That's how we reduce complications and unnecessary hospital visits. So, when should we go to the ER? The emergency room exists for life-threatening or rapidly worsening conditions. Situations where minutes matter. Go to ER immediately for chest pain, pressure, or severe shortness of breath, stroke-like symptoms, facial drooping, arm weakness, slurred speech, severe abdominal pain, especially with fever or vomiting, uncontrolled bleeding or major trauma, head injuries with confusion or loss of consciousness, confusion, fainting, or seizures, severe dehydration, not able to urinate or unable to keep your fluids down, as well as high fever that does not respond to fever-reducing medications. If you're thinking, what if this is serious? Go to ER. Urgent care is designed for non-life-threatening problems that still need attention the same day. They are appropriate for flu-like illness or COVID symptoms, fever without severe red flags, urinary tract infections, ear, sound, sinus, or throat infections, minor cuts needing stitches, asthma, flares, sprains, or simple fractures. Urgent care is often faster and more cost-effective than ER for these issues. A lot of people don't realize, but many urgent care centers now allow to schedule appointments online. That means same day or next day visit, shorter wait times, less time in the crowded waiting area. This can be a great option if you are stable but need in-person evaluation or testing. Now let's talk about the option that's often overlooked, televisits. They can be scheduled with your primary care provider or a virtual care line offered by your insurance company. Televisits are especially helpful if you already done home COVID or flu test and it came back positive. In this situation, medical provider already has an objective test information to support their clinical decision-making that allows them to confirm the diagnosis, accurately prescribe antiviral treatment when appropriate, and recommend symptom management, as well as advice on isolation and follow-up. Televisits can often save you money, a trip out of the house, exposure to others. However, if symptoms are severe or worsening or concerning, a virtual visit is not enough, and you should seek in-person care. So, who can wait and who should be seen immediately. This distinction is critical during flu season. If you are otherwise a healthy person, but you have mild cough, sore throat, runny nose, low-grade fever, and your oxygen is within normal limits, it's often reasonable to wait for 2 to 3 days to see if your symptoms will self-improve with rest, fluids, fever control, and immune supportive vitamins. Many viral illnesses peak early and then improve. But if you have diabetes, hypertension, asthma, COPD, heart or kidney disease, autoimmune conditions, you should generally be evaluated within 24 to 48 hours, even if your symptoms start mild. Because in your case, illness progresses faster, dehydration happens more easily, blood sugar and blood pressure control can worsen rapidly, respiration infections can trigger other complications. Now, let's talk about home tests. They're decision support tools, not a guarantee. If your test is positive and you have mild symptoms, do televisit with primary care, or urgent care may be appropriate. If your symptoms are severe, go to ER. If your test is negative, that does not rule illness necessarily out, but early false negatives are common, so always prioritize how you feel, not just rely on the test result, and get evaluation as appropriate. There are home urinary dipsticks that you can check for UTI. They might be reasonable if your symptoms are mild, you have no fever, no back pain, and no vomiting. Do seek care if your fever develops, back pain occurs, symptoms do not improve within 24 to 48 hours. And remember, negative dipstick does not necessarily rule out infection. I would also like to bring to your attention January workouts warning. Many of us include starting a new workout routine as a part of our New Year's resolutions. And every January, clinics see a predictable rise in preventable exercise injuries. Motivation is high, condition is often low, and this combination often leads to common preventable injuries such as shoulder pain, knee injuries from quick running programs, muscle strains from lifting too heavy, too fast. Experts recommend starting slow, exercise 3 times a week initially, and schedule rest periods. If your pain persists, swelling develops, or movement is being affected, seek care early. Please leave your comments sharing your experiences with televisit services if you tried them, whether you knew about flu home test or home test for urinary tract infections. Do you have urgent care in your area allowing you to schedule online appointments? Your comments and experiences might help someone in the YouTube space. And I'll be happy to answer any questions you post in the comments as well. If you found this video helpful, hit the like button, share it with a friend, and subscribe for more mindful health tips. And remember, joyful heart is the best medicine. Stay well. Till next time.